and letting the country to go awash. This has then created the Reagan, Bush, Clinton people that we see on our doorsteps, in public buildings. This is really a sad testament to the breakdown of civility and respect in America with the ascendance of mercantilization. When we had this privatization movement led by Reagan, who took the philosophy of the right-wing Armageddonists that rationalized their greed with let's drink and be merry for tomorrow the judgment day will come and we don't have to worry about being stewards. This new brand of pseudo-conservatism took over and has been with us ever since. Medicine has been gradually eroded and subverted so that the physician spends not the time with the patient anymore, but responding to the inquiries of the third-party payers or other things that they're called. We now have a secondary level of administrative parasitism that is making Parkinsonian realities, unfortunately, our realities, and it creeps on. And the increasing dependence on this funding then drives the physician's day and distorts the institutions. And how many times do we wish that we could tell the younger physicians that it's not the same kind of medicine as we once knew? But I believe that this will be changing, and someday there will be the realization of he who pays the piper calls the tune, and an additional level of bureaucracy is really harmful and prejudicial for the health of America. The collegial relationships of medical societies and professional societies is eroding. Their membership is going down the tubes as they relate to their facility or their organization bosses that are looking at the bottom line. Medical services are being rationed and attenuated with cutbacks in coverage, with definitely biases towards avoiding paying for mental health. And so we then have with us the rise of the hegemony of the moralism or the stupidity epidemic, where institutions of lower education are supported and mental health facilities are closed, with the shift of people who cannot control themselves being put into the so-called criminal justice system and the warehouses of lower education, which are not rehabilitative in nature but desocializing, creating greater dependency and a brain drain away from the health and the educational resources into this toxic pit of sewage socially that has been brought about by drug prohibition. If one looks upon the toxic influence of the criminal justice system on health policy, you just really can't begin to enumerate the terrible things that have ensued because of shift of power into the criminal justice system.
What would it take to make things better?
Well, very simply, shifting drug policy and laws to control by the Surgeon General away from the Attorney General. It really is very ludicrous to have Janet Reno titularly in charge of the DEA, because they are running their own campaign they're driving and suborning State Department policy and investing themselves into health institutions and health policies. So very simply shifting all drug policy away from the criminal justice system to the health system. We have a very elaborate public health service and numerous surgeons general who could handle this problem that would be strictly based upon harm, and an actuarial form of drug policy would supplant this fragmented special interest group driven situation we have today, where just nomenclature and other definitions of drugs, like starting right with alcohol and tobacco, and to integrate them in with all the prescription drugs as well as the so-called illicit drugs for reports of morbidity and mortality and property loss through casualty settlements. And then depending on these actuarial results based upon an upgraded reporting system, then we would have comparative regulatory or restrictions in access and advertisement. Because right now we have this competing special interest groups anarchy model of drug policy, where we have images of magical potions being foisted upon the public so that they look to these magical potions for solutions to problems, as well as for healing deficiencies and abilities to socialize by showing alcohol as a social lubricant, and with tobacco products being legitimatized through images that are hypocritically partially controlled in one medium but blatantly spread across others. And so we would have this actuarial model where morbidity figures and casualty losses would then determine taxation levels for supporting certain programs that would be administered hopefully by the government.
Okay, but you're talking about big, total big changes in our government and society. I mean, what would be step one? I mean, are you
Step one
are you able to?
this comprehensive law transferring control of drug policy from the Justice Department to the Department of HHS.
Health and Human Services.
And that all of these drug matters would then become part of the health bureaucracy rather than the enforcement corrections world.
Has anyone proposed such a law? Is it in process?
Probably not, because of the current lack of political feasibility, since perceptions of drugs are driven by corporate funded sources, and so you get self-serving depictions of drugs depending on who's paying the piper. So we never will find out the truth. Now, starting a mandatory K through 12 course in critical thinking, as well as a K through 12 course in psychophys ed, where people would children would learn to counteract these alloplastic images transmitted through the media that have driven their parents and their worlds, such as use this underarm deodorant and you'll be more socially acceptable, and having children be exposed to critical responses to these kinds of images, or do you really believe that? And this sort of thing would gradually create much more effective consumers. People would know how to consume more appropriately and without harming themselves.